Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the Dr. Diane Show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I'm excited today to have with me Dr. Pamela Cipriano. She is a nationally recognized expert and nurse practitioner specializing in complex chronic illnesses. She uncovers the hidden causes mainstream medicine routinely misses: tick-borne infections, mold and mycotoxins, heavy metals, parasites, and advanced neuroimmune disorders. Dr. Cipriano treats some of the most severe and misunderstood conditions, including seizure disorders wrongly diagnosed as epilepsy, but actually driven by autoimmune encephalitis. She's known for taking on patients misdiagnosed with ALS, Parkinson's, fibromyalgia, and chronic fatigue, conditions that often have infectious or toxic roots. When every specialist has given up, Dr. Cipriano finds what others overlook and provides a clear path back to health. So welcome, Dr. Cipriano. How are you today?
Thank you so much. I'm very well, thank you. Thank you for having me here today, too.
Of course, of course. And you are doing amazing work. I mean, we know so much more, than just the short bio that I can do when we're doing a show like this, but we're going to get into a lot of that today. And it's so interesting because I feel like, there's so many misdiagnoses out there. That's a great place to start, like what we said in your bio. What do you think some of the most commonly missed root causes of chronic illness are that you see, especially in patients like this, where we're talking about who have been either just, told there's nothing, they don't have anything wrong with them, they're dismissed, or they're misdiagnosed for years. What are you seeing that's people like other practitioners are missing?
So I think a lot of it is that I do treat tick-borne diseases, and that is a host of problems for patients. But I think the big problem is that our testing that we have is not as accurate as we would like it to be. A lot of the testing is antiquated, it's older, it's not as advanced. And so the patients who do come to my practice end up having to pay out of pocket for proper testing. So I use a lot of different types of labs than what we would do through LabCorp Request. And besides that, like the mainstream doctor, 15 minutes tops, maybe, if you're lucky to get somebody for that long of a period of time. There's no ability to actually explain what's going on. And I feel like, especially if you're a specialist, if you're a cardiologist, you're more focused on the heart. If you're a pulmonologist, more focused on the lungs. And if you're a neurologist, more focused on the brain, but only in the areas that you're very comfortable with. So I don't think they look outside the box so much. I'm not saying all. There are an exception to every rule. And I can name some doctors off the top of my head who really don't just, go into overdrive, where they do try and find the root cause of certain things. And if they really can't, they'll eventually refer them to me. But I think that that's a big problem. So, for example, I had two patients back to back who came to me with seizure disorders, and the neurologists were just throwing anti-epileptics at them that were not stopping the seizures. And I don't know anything about seizures. I don't know anything about epilepsy, except for what I knew as an ICU nurse, getting them on an Ativan drip and sometimes intubating them, sedating them if you absolutely had to. But other than that, I really was not familiar with seizures. And when I was trying to figure out the cause of these seizures and why these medications are not working, and getting absolutely no help from the neurologists at all, I did a lot of research. I found a lot of information on the Mayo Clinic and found that when anti-epileptics don't work and people are still having seizures, that it's going to be an autoimmune encephalitis. There's going to be a infective component that's causing this. And when I did discuss this with two neurologists, actually three neurologists, they just ignored me, literally ignored my concerns. And so I eventually had to just pretty much cut them out of the picture and, get the patients on. I followed everything that I had found in research with the, high doses of methylprednisolone, checking their gamma globulin levels, getting them on IVIG, because everything that I tested was positive. And so that was a big concern of mine, that the average neurologist doesn't know anything about autoimmune encephalitis. And if they do, they weren't giving it up for me. They weren't sharing any of their expertise with me at all. I had one patient on 4 different medications plus 2 breakthrough meds, and he was still having seizures. Wow. At some point, you have to figure out, what am I doing wrong, as a neurologist? And, as an acute care nurse practitioner, I didn't expect to have to do their job. I really didn't. So, but knock on wood, both patients are doing exceptionally well. Now the seizures have stopped. They're coming off of their anti-epileptics. So they never actually had epilepsy. They had an inflammatory process in their brain that was causing the seizures.
Right. Yeah, exactly. So I want to back up just a minute. So you said you were an ICU nurse, right?
Yes.
So what made you actually decide, okay, I'm going to stop, working in a hospital or for, a big practice or whatever, and I'm going to go start my own practice? Because there's very few that I know of you happen to be in Connecticut, but even down here in Florida too, very few nurses, whether they're nurse practitioners or APRN, that actually have their own private practice. Mm-hmm. What made you want to do that?
So after an ICU nurse, I went back to school to be an acute care nurse practitioner. And it was a hospitalist, ER, ICU, everything I was very, very comfortable with. And that was like my second home, the hospital, for 30 years. I went to work for internal medicine. It was for a physician whose partner had retired, and he needed somebody who knew how to admit, discharge, round in the ICU. And he didn't know what nurse practitioners can do. And at that point, my husband was tired of me either crying on my way home from work or crying when I got home, because I had such sick patients. And I am very empathic, which I never really thought I was until I was getting myself physically sick over my poor patients. So I took the position and realized, so many doctors don't know how to prevent the disease process, So I take over this practice of a physician who was in practice for 40 years, and all of the patients are pre-diabetic. Some of them are on the cusp of diabetes. And so I'm making rounds in the hospital. I stop in the physician's lounge to grab some papers. And there's a bunch of internal medicine doctors that I've known for years. And I said to them, out of curiosity, when do you talk to your patients about diabetes? And in unison, they said, when they're diabetic. And I said, wow, that is way too late. So I did a lot of research on how to talk to my patients about diet, because my nutrition talks to them were closing their eyes. It's a boring subject. Mm-hmm. And did a lot of research on, glycemic index, glycemic load, and just tried to make it as simple as possible. So I made everybody lists of foods that they could eat that were low in glycemic index. And if the food wasn't listed, they were told just to avoid it, because whatever else was out there was going to just raise their blood sugar. And so every 3 months they were coming in for another A1C. And every month, what I would say to them is, if you stay the same or you go down, that's a win. So we're on the right track. But if you go up, we're losing here. Right. And they all took it as a game. So it turned into a game that was not meant to be that way, but it worked out perfectly. So every 3 months they came in so excited to see what their number was going to be. And for the vast majority, the numbers kept coming down, 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 down. Except for one guy who decided to eat ice cream at night, and he switched the ice cream for saltine crackers. And it was the saltine crackers that actually pushed him over to diabetes.
Isn't that crazy?
Innocent cracker has so many carbs in it. And so that's what happened. Like, I was shocked when I saw he went from a 5.6 to a 6.5. And I was like, that was a huge jump.
Right.
So
it just goes to show you, genetically, how people respond differently to different foods. It's pretty amazing.
It's amazing. It really is amazing. Yep. So when I went for my doctorate degree, it was the program I found was to find a gap in your practice and then correct it. And so I spoke with my advisor and explained that I already did this, and it was going to be a retrospective analysis to see if what I did actually worked. And so there's inclusion and exclusion criteria. The inclusion criteria was they had to be between the ages of 18 and 80. They could never have been on diabetic medications for any reason whatsoever, because there are certain medications you can take for PCOS and things like that. The exclusions were you could never have been diabetic. So in my study, nobody was ever diabetic. Outside the study, I did the exact same thing I did for my patients that were in the study, outside the study. And it was that diet became much more healthy. So it wasn't only foods that are low in glycemic index, but foods that can actually decrease inflammation in the body, things that were much healthier for your heart, how to reverse it, like things that would help to reverse a disease process. We incorporated diet, not only the diet, but the exercise component as well. And I had one patient who was very diabetic. He had an A1C of 15, and he was a truck driver. And I had said to him that he was going to have to go on insulin because he was going to start losing toes and feet and vision and everything.
Yeah.
And he had said to me that if I put him on insulin, they were going to find a way to get rid of him because of that insulin shock. So I gave him 6 months. And in 6 months, he went from a 15 down to a 5.4 on his A1C. So just so your listeners know, diabetes starts at 6.5. Pre-diabetes starts at 5.7, but you really want your A1C around 5.1, 5.2. So 5.4 was a beautiful, beautiful number. And it was just from following my diet, really, and getting some exercise in. So it was amazing to see just how well the diet worked. And then I decided after I got my doctorate degree to open up my own practice. And that's why I named it the Practice of Health and Wellness, because I'm just trying to get people healthy and well and just trying to get them back to their old self. And sometimes their new self.
Yeah.
Sometimes their old self wasn't all that great.
Yeah, well, it's amazing. I mean, like you do so much in your practice. It's just, I mean, we've had a lot of conversations and you've been on a lot of my different shows and, with different topics and things like that. And it just amazes me that just the wealth of knowledge that you have, but then your drive and passion to uncover things that other practitioners, either don't have the time to, or they're not passionate about it or whatever. You seem like you're able to uncover like a lot of things. Just, you're a true detective for sure. So we're gonna get into a lot more. I'm excited to explore a lot more with what you do in your practice. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we will explore more with Dr. Pamela Cipriano. She's a nationally recognized expert and nurse practitioner specializing in complex chronic illnesses. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about my guest, Dr. Pamela Cipriano, at her website, which is www.thepracticeofhealthandwellness.com. So welcome back, Dr. Cipriano. We were just talking about, you really are more like a detective in terms of, just trying to get to the root cause of what people's issues are. It's amazing that you're talking about someone diagnosed with epilepsy and come to find out that's not even the right diagnosis. It was brain inflammation. So let's talk more specifically. You do a lot of work with Lyme and other tick-borne diseases. How do those things mimic other conditions such as like ALS or autoimmune encephalitis or chronic fatigue? How are you seeing that happening?
So it's the inflammation from the tick-borne disease that actually causes the mimicry. MS.
So people are getting diagnosed basically with these other conditions, let's say, but what it really is it's a tick-borne issue.
Yeah. So there are certain diagnoses that are made by exclusion. ALS is one of them. Fibromyalgia is one of them. Parkinson's disease is another one of them. Parkinson's has a specific criteria of more trying to figure out the best way to say this. Physical disorders. So
Mhm.
it's more the head coming forward and the neck getting elongated, a shuffled gait, tremors, things like that. I can't tell you how many patients are diagnosed with Parkinson's disease that do not carry these characteristics.
Wow.
And it's because they don't know why they have these tremors and they're having difficulty with swallowing and things like that. And so they just get labeled with Parkinson's, or they get labeled with ALS, or they get labeled with fibromyalgia, or epilepsy, or other things like that, because it's the common diagnosis. And like I said before, if you're a specialist, you're kind of going towards that common diagnosis because this is what you've been doing for heaven knows how many years. So for you, this is what it looks like. It looks like a
So
duck, walks like a duck. It must be a duck, but it's really not.
exactly. So there's no blood marker for Parkinson's in this instant that we're talking about? Like,
No, there's no blood marker, and there's
really?
nothing to
Okay.
suggest in the brain that there's anything that's going on specifically that's Parkinson's disease. Alzheimer's disease is different. Alzheimer's
Right.
disease, blood work, it has brain imaging that will show it. But Parkinson's disease is really more characteristics of what the patient is presenting with. So let me back up for a second. My cousin, while I was still in school to be a nurse practitioner, and I knew absolutely as much about tick-borne diseases as every other mainstream doctor out there, which is pretty much nothing.
Right.
She was diagnosed with Parkinson's disease, and she had a tremor in her thumb, and she developed foot drop. Those are not signs of Parkinson's disease, but because there's no markers to say that you have it or you don't have it, that's what she was diagnosed with, because they didn't even know what else it was.
Wow.
And we're a very close Italian family. We do everything together. And she started doing holidays and things like that with only her immediate family, like her parents, her husband, children, and then eventually grandchildren. And that was heartbreaking for me because I didn't know what was going on. So my aunt had told me how she had a diagnosis of Parkinson's disease. And so I'm in school, in school with my master's degree, and talking to another student in my class. And we had just finished a class on advanced diagnoses and we were told there is no such thing as chronic Lyme disease. Just finished this class. So now I'm talking to her about my cousin with Parkinson's disease and how upset I was. Like, she's 50 years old. Of course you can have Parkinson's at that, but like she didn't have any of the characteristics of it. And so she said, this could actually be a tick-borne disease. She goes, I have 7 children and 3 of them have chronic Lyme disease. And I said, we just finished the class and they said there is no such thing as chronic Lyme disease. And she said, yeah, I'm looking for an A in that class. I'm not going to get into a pissing contest with the professor, trying to tell her that she's wrong. She said, but she's
Right.
wrong. She's like, I have 3 children like this. So she's like, give me the name of the doctor that her children were seeing. I talked to my cousin about it and she went out there and sure enough, she had Lyme disease and Bartonella. And it was the Bartonella that was causing all of the neurological problems. And so he had put her on, got a PICC line placed, put her on ceftriaxone, which is also known as Rocephin, for 6 weeks. And then he would give her a break for a while and then another round for 6 weeks. And while she was on the antibiotics, she felt horrible because it's killing off so much bacteria. But afterwards,
Right.
she would feel amazing. Her husband, being a pharmacist, so essentially a scientist, was not convinced that this is what was going on because they went to a doctor who wasn't open and honest about what is going on. Didn't explain why he can't take insurance. Didn't explain why he had to use a lab that doesn't take insurance. Like, didn't explain so many different things that he's like, I don't know if this guy's a quack. Like, I have no idea. Like, antibiotics can decrease inflammation in the body, so that might be why you're feeling better. But I don't know if you really have a tick-borne disease. So they went back to a different neurologist. And I wish I had this ability to look inside somebody's body with just my eyes and say, oh my God, you do not have Bartonella. Like she even knew what that meant.
Right.
Because most
Right.
people don't even know what Bartonella is.
Right.
And so put
Yeah.
her on all the Parkinson's meds again. And she went from going in the right direction to just tanking.
Oh.
And so then she went to a different doctor and he said the same thing. You have Lyme disease and Bartonella, and she got tested all over again. But she flip-flopped so many times because she was so confused over who to believe, that it eventually seeded into her nervous system. She became completely contracted in a wheelchair and had to have a deep brain stimulator placed, which did get her out of the wheelchair. And for about a year or 2, she was really doing well, but then the bacteria took over again. And so now she has what looks like tardive dyskinesia, where she has like facial movements. She has, her arms are flailing. I think she's still being treated for Parkinson's disease, which she does not have. But at this point, it's so seated in her body that there's really nothing more that they can do, which is like the saddest thing ever, because if the government would actually do something about making sure that all healthcare providers know about tick-borne diseases, it's not a new diagnosis. I mean,
Right.
Lyme disease happened back in the 70s, 1975 in Lyme, Connecticut, where they thought, a neighborhood of children had rheumatoid arthritis. So this isn't like something brand new. This is going on, oh my God, how many years?
50
I mean,
plus, isn't that
ridiculous.
crazy?
We had
Yeah.
COVID. What was COVID here for 2 years? We know more about COVID than we did about Lyme disease. I mean, now it's just treated like another flu for all intents purposes.
Right. Yeah.
So
Yeah.
it's very,
No, it's
very,
crazy.
very discouraging when I think about how our government just likes to just shove things under the carpet, and people are suffering. And I always say the right person has to get it. But there was a congresswoman who died from the Powassan virus. She was in New York, and it's a tick-borne disease. That's a virus that causes encephalitis, and she died from it. And I think maybe 10 seconds on the news. So I'm not sure who has to get it to make a change. I really don't.
Yeah, I know. It is crazy. It's crazy. It's crazy to think you could be diagnosed with something as serious as Parkinson's and that's not even what you have. Like, that's terrifying to me. Like,
frightening. Even MS, like MS and Lyme disease are very similar in the beginning stages. And both, if you do a spinal tap, can have oligoclonal bands. So having that band does not mean you have MS. It could be MS, it could be Lyme, it could be a number of other things. But neurologists hang on to that MS because it's one thing they know how to treat. If they knew how to treat Lyme disease, these people would be getting better quicker. So there's a lot of patients who do have MS who are misdiagnosed. They end up in my office, and we do the blood tests, and they don't have MS. They actually have Lyme disease.
so I think people will be curious to know, like, what does it look like to work with you? And I know it's going to be different based on every patient, of course, but like, one of the things I'm thinking is, how do you find the answers for these things? Like, what is your process for finding the true root cause of some of these complex illnesses?
It kind of depends on how you present. So if you present with symptoms that are like kind of in my face, that I know exactly what's going on right now, I know what tests to order. But like, I had a patient last week that, I mean, she's doing everything right. She really is. She has found doctors on the internet. She has signed up for nutrition classes. She's changed her entire diet. She's lost 40 pounds just from not eating sugar. She's doing everything. She's right. She's doing everything right, but she still doesn't have a diagnosis. And so somebody like her, who is so sick, physically and mentally sick, it depends on that. Then I'll encourage them to do like the really pricey membership, because that is going to include all the testing. It's going to include literally everything to get you better. And you don't have to pay it over a year. You can pay it over 5 years. We have finance companies that we work with as well. But it's something that it's going to be testing you for heavy metals, mold and mycotoxins, parasites, tick-borne diseases, inflammatory processes, encephalitis. There's so many things we have to test to try and figure out what exactly is going on. So that's really where I come in, is just trying to figure out, where is this person starting and where can I finally get them to end up. My biggest thing I really want to get across to somebody is, whether you knew you got bit by a tick or not, if you feel like your life is going in the wrong direction, find somebody if you're not going to see me, find somebody who's been trained by the International Lyme and Associated Disease Society. Because the vast majority of people who've been trained by them also went to school for functional medicine like I did. So you get to learn about other things that it can possibly be. But my point is I have not been very successful with getting people better once they're in a wheelchair. Like, I have an ALS patient that by the time she saw me, she was completely paralyzed from the neck down and had an appointment for a trach in a week. That is way too late for me to help. Like, as soon as you start seeing that you have foot drop, or you're suddenly losing your ability to hold on to a glass of water, you can't open up a jar any longer, or when you're walking into walls because you're suddenly going to the right all the time, that's a big problem. So I would definitely recommend that people start really paying attention to their symptoms and find somebody who's going to be able to identify the exact cause of what's going on. And it's usually not one, it's usually a host of things that are going on. And then see where you're going to end up, because those are the people that get better.
Right. And you mentioned it's the acronym is ILADS, right? It's ILADS.
Yes, the International Lyme and Associated Disease Society.
Right. Yeah, that's a great organization. They have conferences and all kinds of things. It's and it's a good place where people could find a provider, basically, if they're listening to this and they're not in Connecticut or
Yes, and so they can
something
go
like
on ilads.org, and in there is you can put in where you live and even what type of provider you want.
Oh, that's great.
Yeah, so if you want a naturopath, there's naturopathy. If you want a nurse practitioner, if you sorry,
functional medicine or an MD or whatever. And our cute puppy has joined us today.
Yes, our puppy, our little 5-month-old puppy.
We're gonna actually go to a quick break, even though everybody wants to keep watching now that she's here. When we come back, we'll be talking more with Dr. Pamela Cipriano. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I'm talking today with Dr. Pamela Cipriano, and her website is www.thepracticeofhealthandwellness.com. We were talking just about, how you find all these things that are wrong with people and that other practitioners aren't finding, and I think it comes down to just the type of lab tests that you're doing, the amount of time that you spend with people. Really finding the true root cause of some of these complex illnesses. And one of the things that I think people always think about is, okay, we've been talking about, well, if you get bit by a tick, or you might not even know that you've gotten bitten by a tick, you don't necessarily have to have had that experience to get Lyme disease, but there's other things in your environment as well, like environmental toxins, like mold and heavy metals and pesticides. I mean, how do things like that contribute to some of these neurological or inflammation or immune systems that you're seeing?
So that's a really good question. I actually had a patient who came to me. She was a sad case. She had gotten into an incredibly terrible bicycle accident. I forget what type of team she was on, but she would do the 100 miles. And an SUV hit her while she was in the road and eviscerated her abdomen. And she ended up with a number of abdominal surgeries. From that point, she was living in and out of apartments and renting houses that were infested with mold. And these are things that she didn't know about. And so when she came to see me, she was so physically beautiful inside and out. And she had so many health problems that it absolutely broke my heart. She's a young girl. It broke my heart. Her main problem was that she just was being given so many medications that she really didn't need. Her body was able to correct everything that was going on just with supplements. And so, for example, she had a really bad case of constipation to the point where they wanted to remove her entire colon and give her a bag that she'd never be able to have a bowel movement on her own, because every time she got impacted, it was so severe that she had intestinal surgery. And I came out with something which sounded honestly so silly to me, but I thought to myself, I don't even know if anybody asked her this question. I asked her if she ever tried magnesium oxide. Magnesium oxide is a type of magnesium that does not get systemically absorbed, and it sits in the colon and helps to just pull fluid in so you can have a normal bowel movement. Do you know that that's all she needed for her bowels? That's all. This poor thing went through so many abdominal surgeries. She was at Yale for so many surgeries that they felt they couldn't help her any longer, and they discharged her to Hartford Healthcare. And then Hartford was like, they promised they would get her having a bowel movement on her own again. And then she had a conference call with them and said, you didn't do it, but my nurse practitioner did. And it was something as simple as magnesium oxide. So from there, she had these chronic forms of sinus infections, rashes all over her body, losing her hair. And I kept telling her it was going to be mold. So I tested her for mold and it was positive. And I tested her for heavy metals and it was positive. And so with the mold, she had moved out of the house where the mold was, moved into a different apartment, When I was giving her the binders for the mold, she was getting worse instead of better. And I said, that only happens if you're still living in a moldy environment. And she's arguing with me that she is not. There's no mold. There's no visible mold. They checked it, everything else. I said, I'm
Doesn't
not.
have to be visible.
Yeah. I said, I'm not arguing with you. I'm telling you, you're still living in mold. So they had somebody go in, her parents helped her out, had somebody go in there, and sure enough, that place was filled with mold. So when they moved her into her parents' house, they had the house first checked to make sure they didn't have any mold, and they didn't. They moved her furniture in that they had just bought her to move into that last apartment. They had to get rid of all her clothes and all her furniture because she was so hypersensitive to even the smell of it that she'd break out in this rash all over her body, and her hair was coming out in clumps. So now she's in an area where there's no mold whatsoever. We got her back in the binders, and it took me 1 year to help her. It was actually a little bit less than a year to help her. So it's not like you're going to be with me forever and ever and ever. Like I can usually turn people's lives around in a year.
Mm-hmm.
But it's a lot of testing, and it's a lot of work on their end as well, because they have to, change their diet. They have to make sure that they're either, if they can't move out of their house, they have to get somebody in there to, remodel, get all of the mold out of their environment, or they'll just never get better.
And if people are like, I was
Sorry.
just gonna say, if people are discouraged by hearing that it's taken you up to a year for somebody to get better. I mean, the way that what I say to somebody who wants sort of this more quick fix or instant solving of the situation, it's like, you didn't get there in a week or
Yep.
even a month or whatever. It's probably been a year or multiple years of being exposed to, say, toxins like this, or eating, foods that aren't healthy for you, or not exercise, whatever it is. It probably took multiple years to get to that point where, the body is pretty amazing. And I think it can actually defend itself from most things for a long period of time, until finally it's like, okay, it's just coming from every angle. And, now I'm going to start showing you symptoms. So don't be discouraged when other practitioners, yourself included, say like, oh, well, it might take a year to reverse this. I mean, hey, at least it's reversible. Who cares if it takes a year?
I remember when I did my training with Dr. Horowitz, and then I did a 2-week preceptorship with him, and he had patients that were with him for 14 years. And I remember leaving his office saying, I never want a patient with me for 14 years. I mean, primary care patient, absolutely. If you want to stay with me to stay healthy and things like that. These people were still sick. And for my preceptorship, it was really only tick-borne diseases. I'm not sure if he really got into all the mold and the heavy metals and all that kind of stuff like I do. But yeah, 1 year, next to 14, we're good.
Yeah.
We're doing good here.
What do you find, or what do you think are the biggest red flags that a patient's, quote, mystery illness has been misdiagnosed? Like, what are the things that you look for, that you see?
Well, it's usually that they've seen, by the time I get a patient, we'll start there. They've already seen 10 to 12 doctors, and they're all specialists, and they just can't seem to get better. And that's usually because they've done the mainstream road. They've seen the neurologists and the cardiologists and the pulmonologists and infectious disease and, sports medicine and nutritionists and, exercise physiologists, and nobody can seem to get them better. And by the time I get them, they're so discouraged that they don't feel like there's any hope. And I've never had a patient I wasn't able to help, provided they came to me in a timely manner. So if they came to me, when I can help them, I was always able to help them. And it's just trying to find what exactly is going on. Like, there's a lot of providers in this country that don't think we have parasites. Wake up, people.
Yeah, some still don't think that Lyme disease is a thing either. So
no, there is no border patrol for parasites. They can cross over from any other country to here.
Exactly.
Our world got very, very small. It's an exceptionally small world. We eat things that, back in the day, you're talking, 100 years ago, maybe we didn't have access to, but we have access to food from every single country in this world. And if you think we don't have parasites, you're really mistaken. I had a patient who was passing. She passed and brought, nice enough to bring it into my office, tapeworm, a liver fluke. She was vomiting roundworms. And the doctor she went to see told her there's no way if she did not leave this country that she would be passing worms. So I actually called, there's a parasitologist at Yale. I had sent him an email with all the pictures that I had had from the pictures she gave me and the pictures I had. Because when I sent the actual parasites to the lab, I got back that they couldn't identify what it was. I am not a parasitologist. I could identify what it was. So it's
That's crazy.
it's beyond crazy. It's just beyond crazy to think that we don't have parasites. What I do too is what I started to incorporate is albendazole and ivermectin. And I started doing that even with my Lyme patients because if they're not, first of all, the bacteria can hide in any of our cells. The bacteria can also hide in parasites. If you get rid of the parasites, you get rid of an enormous amount of bacteria in your body. So that's another reason why I also treat for parasites. And sometimes even if a person, for me to get a positive, first of all, for me to get a positive fecal matter parasite, ovum parasite test, I have to send it out to a specialty lab because our labs, LabCorp and Quest, do not have parasitologists that work for them. So you're always going to get a negative because they don't know what they're looking for. And by law, they cannot say they saw a parasite. I've never in 30 years ever gotten a positive OMP unless I sent it out to a specialty lab.
Wow. I bet you that 95% of people listening to this show and even, potentially some practitioners don't know that. Don't know that that the reason that you're going to get a negative result is because they're not allowed or there's not a parasitologist on staff. Mm-hmm. That's crazy.
It's frightening. And if you have puppies like I do, we have 4 right now, and they all sleep in bed with us. That increases my risk of having parasites because all animals are going to have parasites. And no matter what we do to help them to get rid of their parasites, it always puts us at risk. And so for my husband and I, every 6 months, we'll do an albendazole cleanse just to make sure that we're getting rid of any parasites that are in our intestines. And believe it or not, it makes me feel good that I'm actually doing something proactive than waiting for the actual disease to happen before I treat it. So I really try and do, and even with my patients, all my patients, I try and do more preventative medicine as I'm trying to get rid of their current ailments. So everything is about health and wellness. Everything is just about getting back to basics and getting your body really in a healthy place because, we're told that if our immune system is intact, it should be able to kill off parasites. I don't even know where that nonsense came from, I'll be honest with you. I mean, animals have very, very healthy immune systems and they're living out in the wild. They still have parasites. These parasites might not be killing them, but they still have parasites.
And how simple is it to do a test like you just said? Anybody who's got animals.
I use Mosaic Labs. I love them. They've never given me a reason not to use them.
What was the name of that?
Mosaic.
Okay.
Yeah. So I want to say something about well water.
We're going to get to that. We got to take a quick break, but so when we come back, we'll be talking about well water. Now we've got everybody on the edge of their seat waiting to hear for that. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Dr. Pamela Cipriano. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianeHayden.com. And I'm talking today with Dr. Pamela Cipriano, and her website is www.thepracticeofhealthandwellness.com. So right before we went to break, you were just about to tell us something about well water.
Yeah. So this was my personal experience. I had a patient who had thermography. She had thermography done for her breast instead of a mammogram, and I never heard of thermography before. So this is going back almost 10 years now. Mm-hmm. And I was so impressed at how easy it was to read these slides that I contacted the company. And actually, it was April. It was April.
Oh, yeah.
Yep.
CT thermography. Yep.
Yes.
Just give her a shout out.
I do. I love her. I really do. And so she came out and she did a speaker program for my patients. And so in the meantime, I figured, let me get thermography done just so I can tell my patients what the procedure is like. And I had annual mammograms like every other nice, girl that's supposed to do what they're supposed to do, and never, ever had to go back for a second view. So I had a mammogram, I had an ultrasound, never, ever had anything that was abnormal. I get the thermography done, and there was a greater heat index, greater blood supply, greater lymphatic congestion, and one breast over the other, which was putting me at risk for breast cancer in about 10 years. And I was freaking out. I really was. And so she sits down with you and she goes through your entire diet to figure out what are you eating that is causing this. And for me, it was, I don't eat meat. I was eating too much fish. I was cooking the fish on aluminum foil. I had nonstick pans. I was storing food in plastic containers. I was drinking from plastic water bottles. I was doing all the other stuff wrong. My diet, aside from the fish, was super healthy. So everything she told me to do, I did. I got rid of everything. Those things were causing a hormonal imbalance. I actually lost 30 pounds. So this is my normal weight now, but I was 30 pounds heavier than this just from those things that I mentioned. But my breasts did not change. So now I'm like really did not know what else to do to change this. And it was my older son, the reason I got involved with Lyme disease. And so while he was being treated for Lyme, he had done some research on his own. And when he asked me to get him a water distiller, because he had read that it helps to pull anything that doesn't belong in your body out. Right. So he and my younger son and Paul's girlfriend got me a water distiller. And 3 months later, I had my next thermography, because I'm going every 6 months now to see if it's getting better or worse. And that was the first time I ever improved. Wow. So I didn't realize we have a filter on our house, and it was my son who said you cannot filter out all the heavy metals. So anybody who does have well water, first of all, I would have it checked. But just remember, when you get it checked, you're just going to get if it's okay or not. That doesn't tell you how much heavy metals are in it. Right. So having the distiller, the first 2 weeks I drank this water, I started detoxing. That underlying flu-like symptoms. 2 weeks later, I had more energy. I didn't even know what to do with it. So that is the only water I drink. It has to be stored in borosilicate glass. Anybody who wants the information, go on my website, send me a message, and I'll be sure to send it out to you. And actually, now that I said that, I'll just probably put the information on my website so that you'll have it. Mm-hmm. But that is super important, because something like that can cause diseases in your body that you just did not expect.
Wow. Yeah, for sure. For sure. Just quickly, I know you wanted to talk a little bit about parasite. We've been talking a lot about parasites, but how do parasites or stealth infections contribute to chronic UTIs or other like bladder pain or things like that? I think people might not make that connection that a UTI could be related to that.
So I get a lot of patients with chronic urinary tract infections, because my son's main problem because he was my first Lyme patient, was his bladder. He had a lot of bladder pain, and he had a lot of hesitancy where he couldn't urinate. He eventually had to learn how to self-catheterize himself, which luckily that's all improved. But I get a lot of patients with these chronic symptoms, and it's because of a chronic inflammatory problem in the bladder. Just like in the brain, now it's in the bladder. And so when we change the diet, we change the water, I always test people for tick-borne diseases, mold, heavy metals, the same thing I do for everybody else. And there's always going to be positive. It's always going to be positive. So we do microgen testing for the bladder, and you can't imagine how many tests are going to come back positive. But if we get rid of the tick-borne disease, if they happen to have one, or we get you on the right probiotic, those two things help so much get rid of these chronic urinary tract infections.
Wow. Yeah, that's awesome.
Yeah. So it's not only what's in the bladder, but it's actually what's going on in your entire body, because your bladder is a reservoir. So if you do have a tick-borne disease, or you do have heavy metals or mold toxicity, it's going to settle in your bladder, and it's going to cause havoc on the protective wall that protects the bladder wall itself. So it's exceptionally important to really pay attention to your environment, any heavy metals, any mold toxicity, any tick-borne diseases. And like I said, I have so many patients that never remember being bitten by a tick.
Oh yeah. I think more and more that's the case now, that people just had no idea that they were bit by tick. Everybody thinks like, oh, you got to be out in the woods or whatever. Well, that's not the case anymore. They're like in your backyard.
I had an ER nurse who came to me. She just finished a 12-hour shift, and she came in for her visit. She had a tick in her hair. Mm-hmm. Yeah, she didn't go anywhere except from the ER to her car. And in that time, she ended up with a tick in her hair.
Yeah, that's nuts.
It is
Totally.
frightening because they don't fly, but they weigh nothing. So a good gust comes along, it's going to just throw it right onto you.
Yep.
And only
Yep.
about 20 to 50% of people, if it's Lyme disease, are going to get that bullseye rash. The vast majority don't. So I get people too that say, well, I got bit by a tick, but I didn't get the bullseye rash. Well, one tick can carry up to 14 different diseases. So, don't ignore it.
Right. No, for sure. So what can patients do to advocate for themselves if they are feeling like unheard or dismissed by the healthcare system? Like, what would you recommend people do?
I hate to say it like this, but I've been that person. I was misdiagnosed. I had for 2.5 years, I had thyroid cancer. The thyroid was actually growing into my trachea and I was suffocating to death. And I can't even tell you how many doctors I went to see, and not one of them helped me. I eventually passed out, and my son, I was out on disability. My son came home and found me in the shower and called 911. And when they did a CAT scan of my chest, they found the thyroid. I told everybody I felt like I was being strangled, and I felt like I was being suffocated. And everybody heard, oh, she's a woman, so she must be anxious. And so they put me on APRN and Xanax, and I went to see a pulmonologist, and my stats dropped. Well, I walked around his office. My stats dropped down to 60. I had blue lips, and he diagnosed me with anxiety. I had clearly never referred anybody to that pulmonologist.
Yeah,
So
that is
it's
crazy.
very frightening. So you really have to be your own advocate. I'm in the process of writing a book right now, and I'm entitling it "Why You Have to Be Your Own Doctor." Not even your own advocate. You have to be your own doctor. You have to do all the research to try and figure out what is going on in your body so that you can actually find a doctor who can help you. Because if you rely on the insurance-driven medical doctors, they just can't. They don't have the time to research everything. They have 15 minutes with you because they're getting paid literally peanuts. So for them to even make a living, they have to see 25 to 30 patients a day. And that was me. That was me. And unfortunately, my patients had to wait sometimes 2 or 3 hours for a visit with me because I could never do anything in 15 minutes.
Yeah.
If somebody came with a problem, I didn't just in 15 minutes kick them out of my office. I sat there and I researched and tried to figure out what's going on with them, and then realized I can't do this, So there were times I was working 12-hour days, just seeing 10, 15, 20 patients.
It is crazy. It is crazy. But you do. I mean, you have to take responsibility for your own health nowadays. I mean, on so many different levels, whether that's you're going to pay out of pocket to see someone like, yourself or a naturopath or a functional medicine doctor, you stop looking for someone else to take care of you, like your insurance company, because they're basically going to, how many times have we heard stories where people have had to go on some type of a drug or even chemo? And the story is that the insurance company gave them the cheapest form of that first to see if it would work. Really? Like you're going to waste all that time? Like that's just nuts. I mean,
and right now, if you are a provider and you're listening to this podcast and you're taking insurance, you're not working for your patients. You're working for the insurance company, and they are dictating what type of a doctor you are. And that's, I just couldn't do it any longer. I was doing my patients a disservice. I was doing my family a disservice because I would go home exhausted. But then when I got targeted by the insurance companies because I was taking people off their medication because they no longer needed it. They've changed their life. They changed their diet. They started exercising. They lost 30, 40 pounds. I got them off their antihypertensives and their cholesterol medications. And I got 2 nasty letters, one from Blue Cross and Blue Shield, one from Connecticut, for rating me, for taking too many people off their meds. But my favorite line was, I wasn't prescribing enough meds. And that's
not only were you taking them off, but you worked.
I shredded them with my hands. I was so aggravated. I called my attorney and he said, you either have to play the game or you have to stop taking insurance. And that's when I went.
And we're so glad that you started your own practice and went down that path, because now we have you as an amazing resource. So this has been awesome. Again, your website is www.thepracticeofhealthandwellness.com. Thank you so much, Dr. Cipriano.
Thank you so much
for all the great info. Yes, it's been awesome. And I want to thank all of you guys for joining in to the show. Please join me the first and third Thursdays at 11 a.m. Eastern and 8 a.m. Pacific. I will see you guys here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.